Hey guys, today we'll be talking about pseudo Volkmann's ischemic contracture or pseudo VIC. Before that, just like to explain what a Volkmann sign is. So, child with Volkmann's ischemic contracture, if the wrist is in extension, they will be unable to extend the MCP or the PIP or the DIP joints. However, when you flex the wrist, they'll be able to extend the MCP, PIP, and DIP. That's basically what the Volkmann sign is. So I'll show you the help of video. You can see here when the wrist is in extension, when he tries to extend the index finger and the ring and the middle finger, they're not extending. But as soon as he puts the wrist into slight flexion, you can see the index finger is extending more, the middle finger is extending more, and even the ring finger is extending more. That's basically Volkmann sign. So what is pseudo VIC? So it's basically the tethering of the tendon of the FDP, the flexor digitorum profundus, flexor pulsus longus, or the flexor digitorum superficialis in between the radius and ulna fracture site during close reduction of the radius and ulna. So this mostly occurs in children where they come commonly with both bone fracture of the forearm, and when we do close reduction and cast application, sometimes most commonly the tendon of the FDP gets stuck between the fracture fragments, leading to the fracture not uniting, and also leading to difficulty in extension of the finger. I'll show you what I mean by that. So although the clinical examination is similar to VAC, like a mild VAC case, there's no pain out of proportion and there's no ischemic muscle found at the time of surgical treatment. And also there's no history of any compartment syndrome in the child because the fracture has been treated normally. However, so what we have to do to prevent this is, after close reduction, we check passive range of motion of all fingers and make sure that you're able to extend these fingers fully. Okay, and if muscle tethering is detected, then we remanipulate the fracture fragments. And if the muscle is still tethered, we have to open up, make sure there's no tethering, and we'll have to do it manually. There's no other option. So as you can see, according to this table of all the reported cases of pseudo Volkmann's contracture, the most common muscle involved is the FTP. The most common fingers involved are the ring and the middle finger tendons, and most commonly it occurs during ulnar shaft fracture reductions. Okay, thank you guys.